Hey, I'm Dr. Dino Pappas. Thanks for joining me. The content of these videos are my views and my views alone. They do not represent the content of any entity or agency that I may be affiliated with. The topic of today, cervical neck pain, especially when a patient starts to say they have a pinch right here in the side of the neck. So let me answer a question. What is that pinch in the neck? If I bend my head towards my right, this is my right, or in this case, this situation, and the patients will start to say they get a pinch, what they're doing is adding a compressive force towards the right side of their cervical spine. So this is the right portion of the cervical spine. This is the right portion of my neck, my cervical spine. If I bend towards the right, I am closing down or decreasing, compressing the space right on this side here. So for patients that have a sharp pinch with bending towards the side of pain, rotating towards the side of pain, and extending, again, compression of that space, bending towards the pinch, rotating towards the pinch, and extending. So I'm going to give you a strategy and exercise that will help to reduce that pinch or decompress that space. So to do this at home, you're going to need a strap or a towel. This is a handy dandy little mulligan belt. And all I'm going to do, if I get this pinch on my right side, is I'm going to attach the belt around the right portion of my neck. Gentle pressure. We're not trying to choke ourselves. We're not trying to compress ourselves. And with this gentle pressure here, I am tractioning and I am pulling the joint. Actually, let's do this the opposite way. I am tractioning and pulling on my left side, pulling left to right. As I do this, I'm going to slide my neck towards the left side. And as I slide the neck towards the left, I am opening up or decompressing this space on my right side. So sliding, pulling left to right if the pinch is on my right, bending it towards the left. Another method that you can also try is using this same towel, the same belt, pulling gentle pressure. From this position, drop one arm down, left arm down, gonna rotate towards my left, and I'm going to pull. And as I do that, I am mobilizing the joints on the right side of my neck. This is called a self-mulligan or a self-snag. I usually will repeat left bending, left rotation. Again, if right is the side of pain, left bending, left rotation. And if you find that one exercise produces greater relief than another, focus on that. The recommended dosage I'll give patients is usually 2 sets, 10 to 15 reps, holding it 3 to 5 seconds, and have them do that 4 to 6 times a day. Again, what is that pinch? Compression of that joint space. What's the goal of the exercise? Decompress that joint space. And it can either be decompressed through bending towards the opposite side, rotating to the opposite side. If you find one that works better, focus on that. 2 sets, 10 to 15 reps, hold that 3 to 5 seconds, and repeat that about 4 to 6 times over the course of a day. Hey, I'm Dr. Dino Pappas. Thanks for joining me. If you like what you've seen, please hit subscribe and turn on those notifications.